had some really good ones in here today. I think you'll enjoy these. What episode is it? 117, I want to say. Not entirely sure. So this first one here, it was a big old sticky black dark one. I'll be honest, I can't remember much about the patient, so I can't tell you too much, other than I remember it was big, and I think it was a lady. And it was really black. I know she'd been struggling for quite a long time. Now it didn't come out without too much of a faff, this. Took a bit of persuading to get unstuck and to loosen it from the sides of the ache. Now, yeah, a bit of oil would have helped, but like I've said in other videos before, if it's coming, it's coming. Just keep calm and carry on, and crack on. And as I've also said in other ones, it can obstruct your view, it can get blurry. It can be a bit more noisier as well, because if you've got a load of oil in there, when you're putting the suction tube in, you can get a lot of that noises, you know. Sorry that I put anybody off for breakfast or for dinner. Making that can't help myself sometimes. Breakfast or dinner something you have around lunchtime, by the way, just in case you're wondering. Always arguments about it here in the UK. It's breakfast, dinner and tea. But if you're a bit posh, it's breakfast, lunch and dinner. Now when we go out, we don't go out for tea, we go out for dinner. But when we have it at home, you're staying for tea. It's confusing enough. So as you can see, we're having a good old wiggle and a battle with this one, and I think this one's just about to come out. I apologise in advance because I didn't get any ruler shots of any of these. It was a really busy day in clinic. Look at the size of this one. Bits are good, and it's a shame I didn't, because it was a big one, this one. Sometimes when you're literally going one patient to the next, to the next, to the next, as soon as one goes, I've got to clean up, got to tidy away everything. Sometimes I just do leave the plugs like with a tissue over the side of them so nobody can see them when the next one comes in. Sometimes I think I'm just tidying up frantically, and they end up in the bin. And they all did this day because it was very busy and I was running behind, which I don't like doing. But hey, if the first person turns up late, kind of makes everybody else late. What can you do about it? So yeah, if you've got any medical appointments, don't turn up late. It puts everybody else behind. Turn up 5 minutes early would be my advice, at least. Anyway, this second one, I do remember this chap, and he was a lovely chap. And two really full leaves. I think he'd had this done quite a lot in the past. I think, if my memory serves me right, I think it was only 6 months since he'd had it done, which made it more surprising how much he'd managed to grow in 6 months, so to speak. Because there was a lot involved. He was quite well informed, this gentleman. Now you can kind of spot if someone's got a medical background. I try to hide it whenever I'm in the doctors. I can't hide it when I've got my uniform on sometimes, or in hospital. Because it can happen quite a lot when I worked in healthcare. Like, oh, make sure that one's a doctor over there. You know, talk about a patient in another bed, or that one's a nurse over there. So, not that you're not careful with every single patient, don't get me wrong. But it was always a bit of a, oh no, this lot know what they're on about. Yeah, and I didn't actually ask this gentleman if he was a healthcare professional. It was just, you can tell by some of the phrases and the words that people are using, because he was asking me about infections. He didn't have any. And he was asking me, you know, do you think there's any aspergillus in there, which is a type of fungal infection. He's also asking me about Pseudomonas. I don't know, I've not seen Pseudomonas when anyone's here before. I'm sure it can happen, but I've never seen it. And what is that? Pseudomonas begins with a P. The most common place I found it, I used to deal a lot in leg ulcers in my old job. And it's an infection that's quite difficult to treat with antibiotics. It usually helps for silver dressings, because silver is an antimicrobial property, and it helps to kill that particular type of infection called Pseudomonas. Quite easy to spot. You can tell when someone's got a Pseudomonas all over the wounds or their ulcers. Got quite a fruity smell to it. It's you can't explain it, but it's very recognisable if anyone's in healthcare and dealt with that kind of thing. It's it's not a pleasant fruity smell. But yeah, back to these two ears. First one, as you can see, came out pretty well. And the second one, it was Consistency was a bit mushy, but not too mushy where it was particularly difficult to remove. It still kind of held its form, so I was able to remove it by and large. The surface of it is mushy, and then as you can see underneath it, as you start getting deeper down, it's a lot more formed. It's a lot blacker because, you know, if you've been putting oil in, it just tends to soften the top layer of it, which is great. It helps us to get grip, and as you can see, it's not penetrated through deeper down there, but it's still moving out quite well. So I'm just lifting it up from the bottom there. I think it started breaking away in little bits. That's it. It often tends to happen where the first bits are soft and break away, and then when you get deeper down, that's when the whole thing tends to stay together and you can pull it out. But it put up a bit of a battle, this one. It was a good one. He was very happy, the chap, when he left. Healthcare professional now, he was very happy. And said he was going to come back. I think he'd been to lots of providers in the past before. But yeah, he was, again, like most are, quite fascinated with being able to watch it. If not during, then after. You know, I always give people a quick sneak peek. And yeah, they're always fascinated by it. Okay, and he's coming out in thermosis. I think that bit disappeared up. No, it didn't. I was hoping it'd disappear up tube, then I can stay in there and don't have to go and rinse it. You have to remove it from the top of the tip. Dip your suction probe in the into water just to rinse it through so it stops getting blocked. And again, some more coming out. Now these bits did start disappearing up the tube, but keeps leaving a little bit, keeps breaking apart, you know. Whilst it does look quite hard, it is still kind of quite brittle as well. Again, left a few little bits again there. There was a little specket left deeper down as well, which ordinarily I would have got rid of, but it was bugging me a little bit, so I did go in for that afterwards. You know, some of you were saying, you said every little aspect wasn't important. Yeah, I know it isn't. It really isn't. You can just see it in the distance there, can you? It just annoyed me a little bit, that one, so I thought, do you know what, let's just go and get that. So it's the fine-inch tube there. And I wish I hadn't started as well, because it was really frustrated. Just tried to put it, and you've got to be careful, obviously, because this part of the ear canal, the skin's very, very thin. It's just skin to bone. So you can't, you've got to have a steady hand. And my hand is really steady, thankfully. You do pick up shakes when you're recording this type of thing, you know, but because everything's magnified so massively, the tiniest movements will look huge on you, but you know, it'll look like you're doing that, but you're really not. And there you go, nice and clear after that one. So I could sleep easy knowing I got that one out. I think there's oh yeah, put this one on, have a look at this. Some ears are just too narrow. This was really difficult. It's one of the narrowest ones I've ever come across. It was ridiculously tiny, and you could see when I was trying to put in the tube, the skin kept closing in, it kept grabbing the skin from behind it. Wasn't a huge bit like this. But I just thought I wanted to show you this because of how narrow it was. It was absolutely tiny, it was just like a slit, and those are really hard to remove. But thankfully we managed to get that, and this gentleman's a hearing aid user as well. It's got quite a pronounced bend as well.